Hello everyone. Today we'll be discussing the effects of diabetes on the nerve of our eye, also called the retina. With the ever-rising cases of diabetes today, it is extremely important for us to understand how we can protect our eyes against diabetes and what we need to do to protect our eyes when we are diagnosed to have diabetes. And these are the steps we're going to discuss today. Before we talk about diabetic retinopathy itself, let us understand what the retina is. Now this is a model of the eye. This part, this transparent part, is the cornea. Light passes through the cornea and through the lens. Now this part is the lens of the eye. This is where cataract affects. Light passes through the cornea and through the lens to directly reach the retina. This orange part that we see here is the retina. It is basically like a sheet covering the back part of the eye and is the nerve of the eye. The light reaching the retina is then carried by the optic nerve to the brain, and that's how we get vision. Now, diabetic retinopathy mainly affects this part of the eye, the retina. The retina can again be divided into two parts, the central retina as well as the peripheral retina. The central retina, or the macula, is where you get your fine vision, your reading vision from, and then we have the peripheral retina. Now, diabetic retinopathy affects the eye in two ways. It could either affect the central retina, which is called as diabetic macular edema, which causes swelling in the center part of the retina, or it could affect the periphery of the retina. When it affects the periphery of the retina, there are new blood vessels that are formed, and this is called proliferative diabetic retinopathy. Now, when the center of the retina is involved, you have an immediate drop in vision, and this brings us to the hospital obviously quite quickly. Here we do a scan of the center part of the retina, we notice the swelling, and then we treat it accordingly, either with injections or with laser, as the case may be. Now, the most sinister diabetic retinopathy is the peripheral involvement. In this case, unfortunately, we do not have any vision symptoms till the patient actually has a complication, at which point it's already quite advanced. So this is the retinopathy that we want to screen for quite early, pick up early and treat early. Now, what happens in this peripheral diabetic retinopathy is that the eye starts to develop new blood vessels in the corners, and these blood vessels develop slowly, subtly, without any cause or any change in vision. What happens eventually is these blood vessels, because they are young, immature blood vessels, rupture, bleed, and that's when the patient has complications. The aim of diabetic retinopathy treatment is to catch a patient before he or she actually loses vision and treat at that point of time to preserve as much vision as possible. Now, the best time to do your first checkup is at the point of diagnosis. You get diagnosed with diabetes, please go in and see your ophthalmologist and check your retina status. That will be your first checkup. Following which, depending on how your retina is, we'll ask you to follow up. This could be either 6 monthly or annually, or maybe more frequently if we find some changes. There are several stages of diabetes, stage 1, 2, 3. Depending on what stage you're diagnosed at, the interventions will vary. So if you're diagnosed with, say, mild to moderate diabetic retinopathy, it can easily be managed with just controlling your sugars. You're diagnosed today, you're controlling your sugars, we ask you to come back in 3 months, say 4 months, we look at your retina again, your sugars are well under control, you're doing well, you follow up less frequently. You have severe diabetic retinopathy, on the other hand, would require treatment. Say you have vision loss from the diabetic retinopathy, that would require treatment as well. Now, the treatment varies depending on what kind of diabetes you have, diabetic retinopathy you have, whether it is center involving or it is periphery involving. If it was center involving retinopathy, like we spoke about earlier, and you have some swelling in your retina, you would either be treated with some focal laser or, more importantly, with injections, and we follow it up with something called an Oct scan. If you have periphery involving diabetic retinopathy that has a risk of bleeding, it would require laser treatment. Now, this laser treatment is not surgery, it is an OPD procedure where we target the areas where new blood vessels are being formed. We target them with a laser and help in the burning of these areas so that the blood vessels regress and do not bleed. We then follow you up regularly to make sure that it's not complicating further, and at some point, once the retina is diagnosed to be stable, we then follow you up less frequently, but follow up does continue for all diabetics till the end of their life. Like I spoke about earlier, the retina is a nerve of the eye. Now, as we all know, nerves do not regenerate, and diabetic retinopathy is one of the leading causes of preventable blindness in our country today. This is why there is so much emphasis on regular follow-up, early diagnosis and early treatment, so we can prevent vision loss in a large majority of the population. Now the question comes, how frequently do I follow up? Now this depends on what kind of diabetic retinopathy you have, or if you do or do not have retinopathy in the first place. So like we spoke about earlier, the first checkup would be the day you are diagnosed with diabetes. Come in for your eye checkup and have your retina staged. Say you do not have diabetic retinopathy at this point of time, keep your sugars under control, keep your blood pressure under control, cholesterol under control, make sure you don't have anemia or any other associated diseases including hypertension and things like that. And then we would probably like to follow you up once in 6 months to a year. Say at your first visit you are diagnosed with some form of diabetic retinopathy that does not require active treatment. At this point of time, your doctor will talk to you about it, tell you how you can follow up with your sugar control and your BP control, and probably see you back in 3 to 4 months just to see how you are doing. On the other hand, if you have something that requires treatment, say you have swelling in your retina and require injections, then the follow-up will depend on how your swelling is responding to these injections, and your doctor will advise you accordingly. Say you require laser, at this point of time you will be advised laser. The laser is usually performed in 2 or 3 sittings, and once it is completed, you are then asked to follow up probably a month later, and then depending on how you are responding, further follow-ups are planned. Now say you have swelling in the center part of your retina, you would probably be advised an OCT scan, which is a scan of the center part of the retina showing us the thickness of the retina. Based on this, we plan treatment. Usually you would be treated with either injections or some milder form of laser. Now if you are advised injections, the usual procedure is to perform these injections in the operation theatre setup. So what we do is we check your sugars, we check your BP, and if everything is okay, you are taken to the OT, the injection is given. It's a small procedure, but due to sterility reasons, we do it in the OT. It is a relatively painless procedure. Once the injection is done, you are sent back into the OPD. The doctor checks you, and then you are called back for a follow-up, say a month later, to repeat the OCT scan. Now say you are diagnosed with periphery involving diabetic retinopathy. This means that you have new blood vessels forming in the periphery of your retina. The treatment of choice for this particular type of retinopathy is laser, again an outpatient procedure. So you come in on the day you're given an appointment, you have the laser procedure done, again a relatively painless procedure done only with drops, that is topical anesthesia, and after this you are sent home with a drop prescription. You are then called back for a second or a third sitting as and how required, and then followed up depending on how your response to the laser is. Usually after 2 or 3 sittings of laser, you're called back in a month, and then depending on how you're responding, your doctor will advise you further follow-up. So now we've talked about either not requiring treatment and just managing your sugars, or treating with injections, or treating with laser. All of these treatments aim to prevent us from going to the most severe form of diabetic retinopathy, where there could be tractional retinal detachment, where the retina is pulled out of place, or there could be severe bleeding in the eye causing extreme loss of vision. Both of these circumstances would require vitrectomy surgery, which is basically surgery where we go into the eye with specialized instrumentation and treat the retina, put the retina back in place, clear the blood, and so forth. Now the aim of diabetic retinopathy follow-up itself is that we'd hope that our patients do not reach this stage, but if they do, there is specialized surgery that can help treat it. So now we understand what is the importance of diabetic retinopathy screening, why you need to do it, and when you need to do it. So let's talk about how the experience is going to be. The day you're diagnosed with diabetic retinopathy, you've decided to have an eye checkup. You come into the hospital. Given the times, initially your body temperature will be checked, you'll be asked about symptoms of COVID and things like that, and then we will move on to your registration. At the time of registration, at our reception, you should give information saying that I have diabetes and I require to have a retina checkup. At this point, you are directed to the retina department. The retina department is a specialized department dealing purely with the retina of the eye, and this is where you will be screened. The first step here would be that they would check your eye pressure, following which your vision and your eye power will be checked, and your vision is noted for further reference and follow-up as well. Following this, a doctor will see you. Now at this point, we screen for cataract, glaucoma and things like that. Once we make sure that you do not have any of these conditions, we then dilate the eye. Now dilation is basically, we use a drop to cause the pupil of the eye to expand so that we can have a clear view of the center as well as the periphery of the retina, because we know that diabetic retinopathy can involve both the center as well as the periphery. Following dilatation, You may have some blurring of vision for 2 to 3 hours, which is completely reversible. We advise you not to drive preferably at this time and come with an attender. Once the dilatation is completed, the patient is then seen by the retina specialist again. At this point, we do what is called as an indirect ophthalmoscopy, where we check the retina, and depending on what we see, we plan further management. It is a very simple, straightforward process, not cumbersome at all, and a small step like this can prevent blindness in the future. So we insist that you have it done quite regularly. So to sum up, I would like to say that diabetic retinopathy is a very easily preventable and treatable form of diabetes changes in the eye, and just a simple eye examination can help you diagnose it and treat it in time. So I request everyone to please make it a point, if you are diabetic or if your family is diabetic, to please adhere to the diabetic retinopathy follow-up, come in for a checkup, have your retina checked, and prevent a lot of trouble in the future. So please share this information as well as this video with both your friends and your family, so that we can reach as many patients as possible and benefit as many people as possible. If you do have any queries or any questions, you can contact us at our numbers as well through our helplines, and we'll be happy to assist you. Thank you.